Hello everyone, Dan Vijayaratnam. I'm one of the doctors practicing in Melbourne, Australia here. And during this very brief video, we're going to talk about the use of the CDMPal application and pregnancy. CDMPal is a medical software for everyone with health conditions. During pregnancy, you can use CDMPal to manage your pregnancy well, and if you have high blood pressure and diabetes, and you can use the CDMPal application to manage these conditions better. So this video is about use of the CDMPal application during the pregnancy. It's actually an app that you can download from the App Store and Google Play. So I'm going to share my screen with you in a second. And I'm just going to share the screen. Right. Let me share the screen. Okay. Right. So I logged into my CDMPal application. Once you log in, this is your home screen. Feel free to go and update your My Conditions to indicate that you're having high blood pressure or diabetes during pregnancy. You can simply go and add like this plus icon and hypertension, hypertension or high blood pressure during pregnancy, whatever the way that you want to remember these details. And then you go into my medications. If your doctor have given you medication, you can simply list those medications here. Obviously, if you have allergies, feel free to update this one as well. Just imagine that you have to call ambulance, so you have to go to the hospital emergency department. This information can be quite helpful for the doctor because this is the most important information they want to know straight away. MedNote, after seeing your specialist, after seeing your midwife, or going to the hospital clinic, you can create brief medical notes so that you will remember all the details that you discuss with your doctor. A specialist visit, if you discuss certain medication changes or certain advices that you have to follow, feel free to keep a note. If you enable your speech to text or the mic, it will start recording and then putting that one as to text. Again, feel free to keep creating med notes for each and every important medical event. Going back to the topic, if you do have high blood pressure or diabetes complicating pregnancy or both, this section is quite helpful. The first thing is that you probably need to record your weight quite frequently. Feel free to follow your doctor's instructions. Now, this video is a demonstration of the app, not a medical advice. So always follow your doctor's advice. To create a chart, you can add weight, you can enter the details, whatever the number you have, and then feel free to add a note. Specifically around if you have noticed any ankle swellings or if your weight is measured after certain activities, you can create a brief note for the doctor to know as well. If you go to the blood pressure sections, it's very straightforward. You click the plus sign and put the systolic value and diastolic value. Those of you in the audience who do not know what the systolic and diastolic values are, systolic value is the higher value when you check the blood pressure, and the diastolic value is the lower value when you check the blood pressure, and then obviously your heart rate. Again, feel free to add a note if you really want to. Otherwise, you can just submit that reading. If you ever want to share these values or graphs with your doctor, you can simply click here to download this one as a PDF and then share that one with your doctor. Blood sugar reading. This is very important because during pregnancy, your doctor may want you to do different types of blood sugar readings. You click the plus sign and you choose what type of reading, whether it's a fasting, before breakfast, whatever the reading that you want to record. Again, if you're checking that one through millimoles per liter, you can use that one. If you're using the milligram per deciliter, you can use that one too. Very important thing is to add any symptoms that you may have when you're checking the blood sugar reading. Very important for your doctor to know. Again, add a note and submit. Keep doing that one in the frequency that your doctor asks you to do. Very important for them to know what other symptoms you are having, what other problems you are having, and what are the readings of each type of the blood sugar recordings. Very important thing about symptoms. We have discussed adding symptoms in relation to blood sugar readings, but also if you do have other symptoms in between blood sugar readings, you can record it here as well. Very important thing, because when the doctor wants to know about certain symptoms, you may have already forgotten about those symptoms. So it's a very important thing that you record it so that there is a timestamp, so the doctor knows at what time you're developing these symptoms and what are the other symptoms associated with these symptoms. So it's a very important thing that you record this during a pregnancy. Hope this video has helped you to understand the use of the software. Feel free to download CDMPal application. It's a very simple, easy to use medical software app that you, that you can download from Google Play and App Store. We will upload more videos like this, and feel free to visit our website, our YouTube channel, or Facebook group so that you will see many of these videos in the future.